The most common rhythm that we see in the hospital is atrial fibrillation. Now here's an example of what it looks like. It's an irregular rhythm. It comes from the top part of the heart. There's two things about it that makes us nervous as heart doctors and as physicians and as healthcare providers in general. And the first one is that it can make you feel very uncomfortable. You can have palpitations, chest pain. A lot of times people have indescribable symptom. They don't feel themselves. So, and fast heart rates, so you want to bring that down. You can use medications like beta blockers or calcium channel blockers, metoprolol, diltiazem, for example. In strange cases, in uncommon cases, in frustrating cases, you may have to use another one called digoxin. But there are a lot of cases where you want to use stronger medications to control the heart rhythm. Those previously mentioned ones are heart rate controlling medications. So you talk about things like amiodarone, flecainide, ticagrelor, sotalol. Those ones, if you use it, you want to make sure that they don't have a clot in the heart. So sometimes you're going to do a TEE to look for a clot. But more importantly, you want to make sure that someone is on a blood thinner while using that medication, because it does successful in converting you back into normal rhythm. If you have a clot that you didn't know and you use a medication such as flecainide, it can convert them back into rhythm, and then it can break off and cause a stroke. So if you're going to use that medication, you want to confirm that there's no clot with doing a TEE, a transesophageal echocardiogram. Once that's negative, then you can shock them back into normal rhythm and then put them on these stronger medications to prevent the rhythm from coming back, or to prevent the chances of it coming back. Sometimes people will have recurrent episodes despite this. They may benefit things like an ablation to hopefully permanently get rid of that abnormal rhythm. So in summary, atrial fibrillation is an irregular rhythm that comes from the top part of the heart. You can have palpitations, chest pain, and vague symptoms. You treat it with beta blockers or anti-rhythmic therapies like flecainide. If you have enough risk factors and we want to use these rhythm controlling medications, you want them to be on a blood thinner such as Eliquis, Xarelto, warfarin, Pradaxa.